All right. Well, fair and balanced. Democratic strategist Carl Jeffers says while taxes are heading higher, they're still at a historical low levels right now. Carl, you know, yesterday the president said that people who are concerned about taxes or railing about taxes sort of amuse him because taxes are so low right now. First, I mean, should he be amused, and is that what people really are worried about? Isn't it sort of disingenuous to think that people in America are concerned about taxes today and not necessarily taxes tomorrow?
Oh, I think that people are concerned about taxes every day because they know that, like death, it's one of the only two certain things in life. So I don't think that we would segment out just 1 year. The president was in campaign mode, campaign stride yesterday, and frankly, Charles, he actually made some points because he got the crowd laughing, and the reason he got them laughing is because he was pointing out an obvious contradiction in what the Tea Party is doing. The Tea Party started out being against the spending, but what the media and conservative media has done is convince them that what they're really against is taxes, either proposed or current. Well, but Carl, the reality is, once you move over to taxes, the taxes, Charles, right now in America are at their lowest in 60 years, and the average family of four making $63,000 a year is paying almost $1,400 less in taxes right now than under the Bush administration.
Carl, first of all, if I paid $30,000 to go see the president, I'd laugh at every joke that he made. That's number one. But number two,
and the other people laughing with you don't have to pay as much in taxes as the rest of America that's concerned about that.
Well, they can afford it, so it's no big deal. But also, here's the more important point. You can't really take away spending and taxes. Don't you think that people who are upset about spending realize that ultimately it is about taxes? Because how else are we ever going to compensate for the reckless spending that the government's embarked upon?
I agree that there is no question that if you continue to run up deficits in order to subsidize the spending that's done, then one of the most viable ways to try to reduce that is to raise taxes. That is a fair point, and I give you that. The concern I have, though, is that what people are fighting now is, in fact, a ruse in terms of the actual tax situation that they're in today. What they will face in a year or 2 years is certainly significant. But Grover Norquist made 3 points that he has to be worried about. Let me eliminate his first concern. He talked about the value-added tax. That's not going to happen under a Democratic administration because the value-added tax is a regressive tax, and no Democratic-controlled Congress is going to install that. So he can relax on that area because that's not coming.
All right, well, what's the other two? You going to illuminate on those as well?
That's right. Then the second one was that he's talked about the Bush tax cuts expiring. But let's remember when the Bush tax cuts were in force that the fact is that 42% of the net yield benefits went to the top 2% of the earners. So the majority of the American people never got the original benefit. Then the third one was, and this is where he does have a point, there will be some increased taxes on the insurance plans, but there will also be subsidies for families that need help and relief in that, but that will help to balance it. But of the three he mentioned, that was the only one that has real credence to worry about. The value-added tax, the trial balloon was, in fact, floated down by the Senate.
Because I'm really out of time, but you got to tell me, is there any way with the spending we have going on, just yes or no, please, is there any way that the middle class can escape not having higher taxes in the future?
Well, you know how difficult it is with yes or no, but they can escape, yes, if we could get some of that back from Wall Street, redistribute that in a way that was more beneficial. But taxes will go up for most people over the long term.
Thanks a lot, Carl. Really appreciate it. You're always a straight shooter. Really appreciate it, bud.
Thanks, Charles. Good to be with you today.
You're thinking about
quick, revereamerica.org. Click on. We need 1 million signatures. Repeal and replace Obamacare with real reforms.
All right, Governor, thank you. Very good seeing you again.
Nice.
In the meantime, what must Democrats who so strongly supported this health care bill be thinking now? You know, we tried to reach darn near every single one of them, and not a one responded to our request to come on. At first, I thought it was my deodorant, maybe my ties. I had no idea. But this guy did, perhaps because he's coming remote. Carl Jeffers is not a congressman, but he is a very influential liberal, and he remains a very strong backer of this new health care law. But Carl, this is giving many in your party heebie-jeebies.
Well, first of all, Neil, I'd be delighted to come on whether I was remote or right there with you, and I'm sure you use the best toiletries in America, so we have no problem there. So we're fine. I'm very comfortable being here. I'm delighted to come on because I'm delighted to have the opportunity to run down the list of the things that Governor Pataki said. And frankly, I am one that reads this report as cautionary. It does raise some serious questions, and it does concern us about some of the things that it foretells.
But Carl, just step back from something weird.
Sure.
You have the Health and Human Services Secretary coming out gingerly to dispute what was essentially a Health and Human Services report. That is weird. That is discomforting.
But it does happen. But Neil, the actuarial committee said, in fact, that we do not represent the Obama administration. We do not represent the position. This is an independent report.
Sure.
Kathleen Sebelius does represent the Obama administration, so it was entirely appropriate for her to either confirm or refute.
Yeah, but she found herself in a position, Carl, of saying, I dismiss this report, but then pointing out, here are the things I like about this report. I mean, you can't have your cake and eat it too.
I wouldn't dismiss the report because I think the report was fair, and I think that some of the concerns that the report raised we do have to address. But I do think that Governor Pataki and others could balance their criticism, which I respect, with some understanding of some of the positives. Number one, it does confirm that we will be expanding our coverage to 34 million additional Americans.
Yeah, but we're going to lose 14 million. According to this report, up to 14 million could lose their plan as their employers decide, you know what, it ain't worth it, and either dump them on the system or have them figure it out for themselves.
Well, it's not going to be quite that easy for employers to just dump everybody off. And I've heard all of these schemes, forming new corporations, hiring just up to 49 employees, paying the fines. The reality is that it will, in fact, be something that employers will have to weigh very carefully. Number two, those who are then
think about this. You don't have to fire the employees. You crunch the numbers. You say, all right, it costs me $20,000 a year right now to provide this employee with coverage, maybe even Cadillac coverage. I can put them on the government system, suck up the few $1,000 penalty, and still be out ahead.
Well, but that was the next point I was going to make, is that many of those employees would never have had the option to go to any system, to go to any care, because if they did, they would probably be getting it now. The plan does broaden the coverage,
Carl, did you hear what you just said?
34 million people.
Love you dearly, my friend, but you just said it is good news that they have the freedom to drop their employees from their plan.
No, the point being, Neil, is that in the past, they would have either had the option of carrying insurance, which would have covered many of their employees, but if they were not able to carry it, most of those employees would have had no other options. Now, they will have, through the exchanges, through the government pools, at least some other options, regardless of what reason their employer decides not to carry them. And let's remember one other thing, Neil. There's $35 trillion will be spent on health care over the next decade. The plan, as the actuarial committee assessed, will in fact raise the cost and increase the budget deficit by approximately 1%, 0.9%. So that
all I'm telling you, buddy, all I'm telling you is that health care, according to this report, will be a greater percentage of our GDP in the future, which is why I think, and you didn't even realize it, subliminally you're wearing yellow, and a delicious yellow combination, I might point out, because you are afraid.
Oh, no. I wore it because it was a contrast to what I wore last week with that particular color combination. So fear has nothing to do with it. In fact, with healthcare, the only thing we have to fear is fear itself, if you want to go that route.
All right.
That's right,
Carl,
Neil.
good seeing you again, Carl Jeffers.